FUE versus FUT versus DHI. This is going to be the topic of today's video, guys. You're going to love it. It's going to be very in-depth analysis on these three methods of hair restoration. I'm going to be referencing many studies throughout this video, and I'm going to also react to this comparison of these three methods, which has been created by one Turkish clinic. I'm not going to name this clinic. Throughout this video, I'm going to share with you what is all wrong with this comparison and why I think it should be different. Hope you're going to love it. Let's start with the video.
This video is brought to you by GoFiber Hair Building Fibers. Pick up your free sample and get instant hair confidence. Start your transformation today.
Hey, welcome back. This is Matt. You're watching my hair loss and hair transplant related channel, which is full of hair loss and hair transplant related topics also in 2021. So make sure you subscribe to my channel. There are two things you should do in 2021 if your goal is to have a successful hair transplant. Number one, join my Facebook group Hair Transplant Experiences with over 1,500 members in it. Number two, check out mattdominance.com where you can get my free ebook 5 things I wished I had known before my hair transplant. Also, you can check out a bunch of guides on how to get the best hair transplant in Turkey, best hair transplant doctor collection, and how to do a proper research. These are all the things that many of you guys before you already used or made use of, and we're really thankful for that. And I really appreciate for all the emails or the support that you guys are texting me on Instagram. Thank you so much. I'm glad to be helping you out with this. And now let's come to the topic of today's very exciting video. There was one member in my Facebook group who posted this comparison because he found it on the website of one unnamed Turkish clinic. I don't want to talk bad or good about this clinic. I want to stay as neutral as possible. I just want to share my opinion on this comparison and share with you what is wrong with this comparison, and maybe there are also some things that are truthful or good. We have several factors here on the left: natural appearance, permanent results, hair density, and so on. And then we have the three hair transplant techniques on top: FUT, FUE, and DHI. Now, as far as DHI actually is not being referred to as a hair transplant technique, it's only FUE and FUT. If you check out ISHRS, International Society of Hair Restoration Surgery, you will find out that there is no DHI as a technique. DHI is just oftentimes utilized during FUE, follicular unit extraction, as a different way of implantation, where doctors use implanter pen. It can be a Choi pen or a different types of implanter pen, which doesn't require to create incisions first, but rather there is a charger who charges the graft in the pen, and there is a placer who uses the pen to place the graft. But DHI can be in fact utilized during both FUE and FUT hair transplant. Don't see DHI as being something superior to FUT or FUE. It's just different way of placing the grafts, and it can be utilized during FUT and FUE. So this is something that I wanted to have said first, and now let's talk about the natural appearance. It says that the natural appearance somehow will be like the lowest with FUT. With FUE it's gonna be more natural, and with DHI it's gonna be like the most natural. How? How is that? How is it possible? The factors that influence the naturalness of the whole hair transplant don't really depend on the implantation method, as they pretty much depend on single grafts in the hairline. Is it gonna be placed in a proper angle? The angles are more acute on the temples, also on the frontal hairline, and they are becoming less and less acute as the grafts are being placed toward the central region, mid-scalp, and crown. Is it going to match the surrounding hair in terms of thickness? There is the experience of the physician, which will vastly influence all of that. So guys, please don't fall for these cheap tactics and tricks where clinics are saying that DHI is somehow going to produce more natural appearance. It's not. It's pretty foolish to claim that just the implantation tool, being the DHI implanter pen, will somehow assure a more natural appearance. So be it the forceps or be it the implanter pen, this only will not have a big impact on how natural the appearance will be. So here I would say everywhere there should be an equal number of stars, FUT, FUE and DHI. Permanent results. FUT 2 stars, FUE and DHI 3 stars. They want to tell us somehow that FUT has less permanent results compared to FUE and DHI, which is the biggest bullshit I have ever seen, I guess. First, how do you measure that? How do you know that DHI has most permanent results? Do you have a study? Did you conduct some type of trial or case study, cohort study in your clinic? I don't think so, because this clinic seems like it's FUE only clinic and it's probably utilizing DHI in 90% of their patients, so they don't even know how it is with FUT, I assume. So this is pretty foolish to claim. I would actually claim that the most permanent results are gonna be expected with FUT, and there are two good reasons for it. Number one, the strip is usually done from the most permanent area of the donor zone, where the hair is very unlikely to thin. That's why. Number two, with FUE and DHI, because DHI is being often used in conjunction with FUE. During FUE, the doctors also harvest like above and below and also on the sides of the donor area where there is a risk of thinning in the future. And that's why if you extract these grafts and transplant them, it can be likely that they may thin out and some of them may fall out in the future over multiple years, over decades, okay? They may thin a little bit. It's of course more likely compared to the FUT and the hair coming from the strip, from the center of the donor area. Now, the second good reason why the permanency of results with FUT is going to be higher, or is likely to be higher compared to FUE, is the strip, which is cut out from the donor, and the follicle in the strip are usually more chubbier. They're coming with more surrounding tissue, which is protecting them as well. With FUE and DHI, the grafts are usually more skinny. They seem to be more trimmed because they're being isolated during the extraction one by one, and there is less surrounding tissue, which could protect them. And they actually made some studies on that and found out that the grafts which have more surrounding tissue around them versus the skinny grafts, the grafts which were chubbier had a better survival, not just initially, but after 6, 12, 18 months and so on. So the survival of the grafts can pretty much change even from the 12, 18 month on post-op, and that's what they tracked, and they compared the skinny grafts versus chubby grafts. Also, it decreases dehydration when the grafts are moved between the extraction and implantation phase. So it's actually, I would claim that the permanency of the results with FUT should have 3 stars and FUE and DHI probably 2 stars, based on how the grafts are handled between the extraction and implantation phase. We obviously know that there are so many things that can pretty much influence the survival of these grafts. We have the first important thing, which was the protective tissue around the graft. Also, implanted graft density per square centimeter. If you implant it way too dense, the survival of the graft may not be as high because of the limited blood supply on the recipient area. There are like 5, 6 other factors which can pretty much have a big impact on the permanency of the hair transplant result. Here, I have to say that with DHI, it's gonna be easier, technically easier for the doctor to dense pack a high number of grafts per square centimeter compared to FUE and FUT. But I also see no reason why FUT should produce somehow less hair density compared to FUE if there is the same implantation technique used. It's pre-made incisions, create the recipient sites first, and then implant the grafts. So FUT and FUE have totally equal hair density possibility, and the DHI, again, it's technically easier to dense pack a little bit more per square centimeter compared to recipient sites. Now, these incisions unfortunately have to be made a little bit bigger initially, because it takes maybe 30 to 60 minutes even to, create like hundreds and thousands of incisions, and by the 30 to 60 minute time period, they will shrink in size a little bit. So the grafts, by the time they will be placed, they will have like the perfect size. The incisions will have the perfect size. If they would have been made way too tight initially, it can happen that by the time the assistant will try to place them in, he cannot fit them in because they would have already shrunk down way too much, and it wouldn't be really possible to place the graft inside correctly anymore. This initial creation of slightly larger recipient sites in diameter restricts the doctor to dense pack these incisions compared to DHI, and that's why technically it's harder to do the dense packing if you do the pre-made incision. But it also doesn't mean that the result cannot be dense with FUT or FUE. In fact, there are many doctors who can do recipient sites on the hairline with like 35 to 40, even 45 recipient sites per square centimeter, where only singles will be placed, and such density is already really good. And there is also a drawback to like implanting 60 grafts per square centimeter and higher, because they may not get the proper blood supply and eventually they may not survive in the coming weeks and months, and then you get a poor growth, and then you wonder why is this so, despite having like super high density on the hairline initially. Be careful of that as well. It doesn't always mean that if you get a very high density implanted on the hairline, everything is going to also grow. It's not the case. So be careful about that as well. And if we compare DHI and stick and place, which is another implantation technique which some clinics I know utilize, it's very similar to DHI, and it's in fact very likely to create a high density as the same as with DHI, because by stick and place the incisions will not have to be made too big initially, but they can be made very tight, and there is one sticker and one placer, one who does the incision and another person who places the graft immediately in there, so they don't have to wait until they create like thousands of incisions and then start placing. So when it comes down to stick and place, which is another implantation technique, and this technique pretty much can be utilized with FUT or FUE, so there is no discussion about the hair density even. I mean, if we assume that there is stick and place technique that can produce equally dense results compared to DHI, and this stick and place technique will be utilized during FUT or FUE, then I would say that even FUT or FUE and DHI can pretty much have the same hair density overall. Okay, the number of stars should be equal in all of the fields, in my opinion, assuming we utilize like stick and place with FUT or FUE. It's very comparable to DHI, or even if we utilize DHI with FUT, I mean, there is no debate. Okay, hair transplant without scars. Well, FUT is clearly being knocked down here as well. FUE a little bit better, and DHI again should be the best. Now, is it true? Well, you should specify. Do you mean scars on the donor area or scars on the recipient area? If you mean scars by the donor area, obviously FUT would have probably 1 star because it has like the most visible linear scar, but FUE and DHI are not scarless either. Okay, they produce these circular scars, and there are like thousands of them. If you get like 2,000 grafts with FUE or DHI, it's going to be 2,000 small tiny circular dots. These dots will not disappear. Okay, it's a scarred tissue which is permanent, and FUE and DHI, as far as the donor scarring, should have the same number of stars, so probably 2 stars and not 3, because the extraction method which is utilized during DHI is obviously FUE extraction. Again, DHI is just an implantation method. It doesn't have anything to do with extraction of these grafts, so they're harvested usually with FUE. So as far as the scarring on the donor area, I would say 1 star FUT, 2 stars FUE, and 2 stars DHI. Now, 3 stars, I would give only a technique which would be somehow able to extract the grafts from the donor area without creating any type of scarring. As far as pain-free hair transplant, FUT has 1 star and FUE with DHI have 3 stars. Every hair transplant should be pain-free if the doctor numbs the donor area and recipient area correctly. Usually patients feel like no discomfort during the hair transplant, and even if they feel it, they usually feel it during the numbing phase, and then usually it's okay. And if the numbing starts fading, usually you should tell the doctor to numb you more, or again. There should be like equal number of stars everywhere. Now, as far as the post-op discomfort, like pain, doctors usually give you painkillers, and many times guys don't even use them because the pain is not there. But they did a study where they compared like 200 something FUT patients and 20 or 30 FUE patients based on a Wong-Baker FACES pain scale. You can see it here. And actually they found out that patients after FUT have felt some type of pain for the first 3 days after the procedure, while by FUE patients the pain usually was only like noticeable like 1 day after the operation, and then it wasn't really that bad. So this is an actual study. So I know from guys who have done FUT, I know from myself, I have done multiple FUEs, that the pain after the procedure from the FUE is really not that bad. From the FUT, I don't think it's that bad either. It just can last maybe a couple days longer. But again, that's why you have these painkillers to help you out with that, okay? So this is not a very decisive factor based on which you should be like choosing between different types of procedures. So this shouldn't really kind of weigh into your decision that much as far as choosing FUE or FUT. So I would say 2 stars FUT, 3 stars FUE, and 3 stars DHI.